And yeah, we can have that from JNK Ophthalmological Society, Dr. Younis Dar can present his thing.
Very good afternoon to all of you. I am Dr. Younis. The title of my topic is pseudoexfoliation. Look what else we found. In other words, these are the systemic manifestations of pseudoexfoliation syndrome and pseudoexfoliation glaucoma. Pseudoexfoliation syndrome is a complex age-related multi-system disorder of extracellular matrix leading to overproduction and accumulation of pseudoexfoliative material in both ocular and visceral organs. Most common identifiable cause of open angle glaucoma worldwide. Open and closed angle glaucoma cataract with zonular instability increases systemic risk of cardiovascular and cerebrovascular disorders. More common in old age groups, 60s and 70s. It can be unilateral, bilateral with no sex predilection. There is geographical distribution patterns most prevalent in Scandinavian countries and in Kashmiri population. About 40% of patients with pseudoexfoliation will develop glaucoma, and 20 to 25% of open angle glaucoma patients worldwide have pseudoexfoliation syndrome. Pseudoexfoliation syndrome in India, based on population-based rate, is ranged from 3.8 to 6%, while its prevalence in Kashmir is reported to be about 7% in multiple studies. And in another study in South Kashmir, we screened 3,000 patients in which it was found that pseudoexfoliation was prevalent in 9.5% of the population. There is paradoxically higher incidence and prevalence of pseudoexfoliation in Kashmiri population. Higher prevalence in this population implies higher risk of associated systemic complications. This study aims to improve the understanding and outcome of patients with pseudoexfoliation. Preventive measures can be taken to reduce overall burden of ocular and systemic manifestations. Pseudoexfoliation inherited microfibrillopathy with transcribing growth factor beta 1 oxidative stress and impaired cellular production are the key pathogenic factors. Polymorphism in the coding region of lysyl oxidase like 1 protein gene. This is the diagrammatic representation showing pathogenesis of pseudoexfoliation. Risk factors are in the form of hypoxia, ultraviolet exposure, smoking, higher altitude, lower ambient temperatures, decreased level of antioxidants, higher foliate intake, and increased coffee consumption. Exfoliated material is seen in other tissues such as heart, lungs, liver, kidney, gallbladder. There are different systemic manifestations in the form of vascular coronary artery disease, hypertension, angina, abdominal aortic aneurysm, renal artery stenosis, peripheral vascular disease, cerebrovascular disease in the form of transient ischemic attacks and strokes, sensory hearing loss, Alzheimer's like dementia, pelvic organ prolapse, and indirect inguinal hernia. There are different clinical features in corneal flakes of exfoliative material and pigment epithelium, corneal endothelium, changes in endothelial cell size and shape, and decrease in cell density, corneal endotheliopathy in pseudoexfoliation. Not only cornea is involved, there is zonular instability, phacodonesis is there, capsule is involved. This is typical double ring sign of pseudoexfoliation. This is pseudoexfoliation along the pupillary margin. This is cornea guttata or pseudoexfoliation endotheliopathy. In aim of our study is to assess systemic manifestation in patients with pseudoexfoliation glaucoma. Objectives: to analyze associations with vascular comorbidities including peripheral arterial disease, ischemic heart disease, cardiovascular disease, aortic aneurysm, and hypertension. To determine the prevalence of sensory hearing loss in pseudoexfoliation syndrome and pseudoexfoliation glaucoma patients using pure tone audiometry. To evaluate peripheral arterial disease using ankle brachial index and lower limb Doppler ultrasound. It was prospective observation cross-section study carried over a duration of 1 year in our college from June 2020 to June 2024. After proper approval from ethical committee and review board approval was taken. A total of 200 patients were included, divided in 3 groups. Group A, 50 patients with pseudoexfoliation syndrome, 50 patients with pseudoexfoliation glaucoma, and 100 age and sex measure controls without clinical features of pseudoexfoliation. Inclusion criteria was age more than 50 years, presence of pseudoexfoliative material on ciliary limb examination. Pseudoexfoliation glaucoma defined as pseudoexfoliation syndrome with glaucomatous optic neuropathy, raised IOP, and visual field defects. Exclusion criteria include history of ocular trauma or intraocular surgeries, presence of glaucoma not attributable to pseudoexfoliation syndrome, known autoimmune or connective tissue disorders, long-term use of corticosteroids. And ophthalmic examination was done using visual acuity, cilium examination, IP measure, gonioscopy, dilated fundus examination, and visual field testing. And proper systemic evaluation in the form of to rule out hypertension, diabetes, ischemic heart disease, aortic aneurysm, cerebrovascular and peripheral arterial disease. Pivotal odometry was done to assess sensory nerve hearing loss and ankle brachial index to screen for peripheral arterial disease. Relevant investigation includes serum homocysteine levels, lipid profile measurements, ECG and echocardiography. Ultrasound Doppler of the anterior tibial artery, dorsalis pedis and their distal branches was done. Statistical analysis was done, then results. Mean age in the pseudoexfoliation syndrome group was 74 years and pseudoexfoliation glaucoma was 72.9 years. And p-value was 0.02. This difference was statistically significant, underscoring the known age-related nature of pseudoexfoliation syndrome. This also supports prior epidemiological findings that prevalence of pseudoexfoliation glaucoma increases with advancing age. These are the systemic associations. Though hypertension was slightly higher in pseudoexfoliation group, but this was not statistically significant. And prevalence of diabetes, it was equal in all the groups, showing no association in our study. While there was a notable difference in ischemic heart disease, the difference was statistically significant, indicating a potential association between pseudoexfoliation syndrome and coronary artery disease. Aortic aneurysm was statistically significant in pseudoexfoliation syndrome and pseudoexfoliation glaucoma group compared to control group. And this difference was statistically significant, suggesting a clear association between pseudoexfoliation syndrome and vascular structural abnormalities.
Excuse me, Dr. Dar, you can conclude. Your time is up, actually.
Yes, ma'am. This is the diagrammatic representation of all these associations with pseudoexfoliation syndrome and pseudoexfoliation glaucoma. Peripheral arterial disease, we did Doppler ultrasounds and ABI findings. In Doppler ultrasound, we did all these 4 parameters: intermedial thickening, plaque presence, loss of triphase, monophase, and reduced flow velocity. And all these were significantly higher in pseudoexfoliation syndrome group and pseudoexfoliation glaucoma group compared to
Sorry,
cases.
Dr. Dar, excuse me.
This study reinforces the view of pseudoexfoliation as a systemic disorder with significant vascular and neurological associations.
Dr. Dar, excuse me, your time is up. You can conclude.
I'm concluding it.
Yeah, please.
Thank you.
Thank you.